Hi guys, welcome to Nursing Jellyfish. Today let's see the all nursing competitive exam preparations such as Prometric, Nclex Haad DHA, even AIMS, RRB, ACC, MRB, every exam. So today let's see the question paper. The nurse is developing a bowel retaining plan for a client with multiple sclerosis. Which measures is likely to be least helpful for the client? It is. So option A, limiting fluid intake to 1000 ml per day. Option B, providing a high roughage diet. It is. Option C, elevate the toilet seat for easy access. Option D, establishing a regular schedule for toileting. It is. See, what is the meaning of multiple sclerosis? This question is repeated, they are asking. So what is that? It is going to be affect the nerve covering layer. So you can look at the picture in the before, and the myelin sheath is damaged, so that is why you are getting the problem of multiple sclerosis. It is, you will get a pain and numbness, weakness, and the pain in the occipital, all limbs pain, everything is going to be, coordination is going to be affected. Okay, for that condition of the patient, so what is the bowel retraining plan? It is, what you have to do for it? It is, okay, do you understand the question? Okay, what is the correct answer here? Yeah, limiting fluid intake to 1000 ml per. Option A will be the correct answer. Next, to move on to the another question. Which organism is responsible for the onset of rheumatic fever? It is. Option A, Staphylococcus aureus. Option B, Listeriosis. Option C, Group A, beta hemolytic streptococcus. Option D, Epstein-Barr virus. It is. So everyone knows it is. What is that? It is. So mainly it is onset of rheumatic fever. It is caused by Group A beta hemolytic streptococcus, only the main causes. If it is rheumatic fever is coming, it is going to affect the joints and also heart. It is. Okay, that is the main complications. Other than that, it is not would be causes of that. Okay, next move on to the another question. For what reason are patients instructed to do Hegel exercise when they are discharged from after the childbirth? It is. Okay, option A, they help her get back to in shape. Option B, they prevent her breast from becoming engorged. Option C, they help strengthen the perineal muscles. Option D, they help reduce strain in the back. It is. So what is the main reason you have to tell the patient to do the giggle exercise? Okay, giggle exercises, we are going to be strengthen the pelvic floor muscles. I think you have understand the pictures. Okay, fine. Okay, the pelvic floor muscle is going to be strengthened. It is going to be affect the urinations, and the other problems are going to be prevented. It will be regain the shape also of the uterus. It is. So what is the correct answer here? Your option C, they help strengthen the perineal muscles, will be the correct answer. Move on to the fourth question. You are preparing to discharge a patient who suffered third-degree burns. Which of the following instruction is appropriate to give the patient to decrease infection? It is. Okay, option A, you must take large amount of fluid. Option B, you should wash your hands thoroughly. Option C, you better increase intake of vitamin D. Option D, you should avoid fatty meals. It is. So what is the correct answer here? Actually, third-degree burns. It is. So what you have to do, how to control the decrease the infection? It is. So what is the correct answer here? Yeah, option B, wash your hands thoroughly. So that will be the correct answer for this fourth question. It is. Move on to the next question. The most effective procedure to prevent spread of infection is option A, wearing gloves. Option B, using antiseptic. Option C, sterilization. Option D, hand washing. So what is the best method to prevent the hand washing? Everyone knows we are wearing gloves, antiseptic, whatever it is going to be, not going to be reduce the infection. It is. So and also not even it is spread of infection is not going to be controlled. So that is why what you have to do for it, that is option D, hand washing is the best answer for this question. It is. Move on to the sixth question. What is the normal pulse range for an adult? It is. Option A, 120 to 160 beats per minute. Option B, 90 to 140 beats per minute. Option C, 60 to 100 beats per minute. Option D, 50 to 80 beats per minute. So what is the correct answer here? You know this. It is. Usually the pulse range is going to be 70 to 82. It is a normal pulse rate, but they are given for the range it is. So that is what is the correct answer here? Option C, 60 to 100 beats per minute. It is a correct answer. It is a bradycardia. If it is more than 100, it will be the tachycardia. Everyone knows it is. Okay, fine. Okay, move on to the seventh question. A 4-year-old girl was playing outside in a park when she came running to her mother, crying and hold her right upper arm. It is. So 2 hours later, they presented to the emergency department. There was a swelling over the upper right arm with pain and itching at the site, as well as swelling of the oral mucosa. So the child seems, what is the most appropriate steps in the management? It is option A, administer subcutaneous epinephrine. Option B, maintain a pattern airway. Option C, administer oral diphenhydramine. Option D, prepare intubation equipment. It is. What is the question here? The child came with the complaints of right upper arm pain with along with the swelling of the oral mucosa. So that means it's going to got some allergic reactions also. So you have to, what is the main nursing action you have to do for it? That is maintain the pattern airway. So that will be correct answer for this question. Okay, move on to the next question. A 65-year-old man present with a resting tremor in the right forearm in assessment of gait reveals decreased arm swinging and slight dragging of the foot on the right side. His body movements are very slow. He has not been sleeping well at the night for the first 6 months due to leg pain and says that feel constantly tired and weak. It is. He report that has not suffered any recent fall and also symptoms seem to be slowly worsening. It is. So which medication is most likely to be administered? Actually, the what is the question here? Old man presence of tremor in the forearm and also gait level is disturbance and tracking at the foot also for the SARS 6 month. It is. Okay, option A, levodopa. Option B, penitine. Option D, benzodiazepam. Option D, haloperidol. Usually which condition these are the symptoms are going to happen, that is called it as Parkinson's disease. It is. Okay, if the patient is having Parkinsonism disease, so what is going to be decrease in the body level, that is called it as dopamine. Because of the dopamine only you will be getting the disease. So that is why option A, levodopa, if you will administer, so all the problem is going to be resolved for this. So the correct answer is levodopa. It is. Move on to the ninth question. When planning discharge, teaching for the parent of one infant with bronchiolitis, the nurse should emphasize option A, use of supplemental oxygen at night. Option B, frequent hand washing. Option C, sleeping in the supine position. Option D, rice thickened formula during night time feeding. It is. So what is the correct answer here? So what you have to do for the when planning discharge teaching for the patient? It is. So what you have to tell the patients? It is, yeah, you have to tell the patient you have to do frequent hand washing is very essential for the bronchiolitic patient. It is. So option B will be the correct answer. Next, move on to the 10th question. A home care nurse visited a diabetic client who was started on insulin injection. Upon examination, the nurse observed small lump and dent on the right upper arm where the patient has injected insulin. What is the best nursing intervention? Option A, refer the patient to a dermatologist for diabetic cellulitis. Option B, instruct the patient to rotate the site of injection. Option C, refer the patient to an endocrinologist for better control of glucose level. Option D, instruct the patient to inject in the intramuscular area instead of subcutaneous area. So what is the correct answer for this question? Actually, the patient is having lump on the right upper arm. It is. So what you have to tell the patient? It is, what is the best nursing intervention? So instruct the patient to rotate the site of injection. It is. So the option B will be the correct answer. 11th question. When is the correct time for the nurse to administer the child's morning dose of a combination of regular and NPH insulin? It is. So option A, 30 minutes before breakfast is served. Option B, 15 minutes before breakfast is served. Option C, 30 minutes after breakfast is served. Option D, 15 minutes after breakfast is served. Actually, what is the question here? When you have to give the insulin, before or after food? Like that the question was asked. So they have specifically they are given the time it is. Usually for the regular and NPH insulin, when you have to administer, that is before 30 minutes before breakfast it is. So that means option A will be the correct answer. Next question. The client has on order for administration of 10 units of regular insulin to be given at 7 a.m. The nurse should offer a snacks at option A 3 p.m., option B 1 p.m., option C 9 a.m., option D 11 a.m. Actually, what is the time they are given for that? It is 7 a.m. they are given the regular insulin. That means after 30 minutes you have to give the food it is. That means 7:30 you are given the food. That is breakfast was completed. Okay. Now when you have to give the snacks it is. So 7 o'clock mean 8, 9. That is after 2 hours it is. So usually what is the time it is? 9 a.m. you have to give the snacks it is. So that is the best time to give the snacks at time. Okay. Next question. The client is being treated with NPH insulin at 8 a.m. The nurse should offer a snacks at option A 9 a.m., option B 11 a.m., option C 6 p.m., option D 2 p.m. it is. See, before they are given that it is what is the question here? That is administration of 10 units. They are given in the previous question. Okay, that is different. That is for regular insulin. Okay, but here they are given that it is NPH insulin at 8 a.m. First, you will understand what you may be normal insulin and NPH insulin. Normal insulin, it will be activated within 1 to 2 hours. So the level is going to be reduced. After peak, it is going to become, then afterward it reduces. But not NPH is not like that. So when you are given the injections, it will be reach the peak level at after 6 hours it's only. So that is why they are given the food at as 8 o'clock. So you have to reach at 2 p.m. You have to give the snacks it is. So that is why option D will be the correct answer. That means what is that? NPH insulin is going to be peak at up to 6 to 8 hours of the time. So the blood glucose is going to be decreased that time only. So that is why you have to give the time is gap it is 2 p.m. it is. So option D will be the correct answer. Do you have understand the question? Next question 14. A client with diabetes come to the emergency department. The nurse obtain a blood glucose measurement with the glucometer and notes that it is 510 mg per deciliter. The physician ordered IV insulin. Which type of insulin can be given both intravenously and subcutaneously? So that means what type of insulin we are going to give, the intravenous and normal, that is subcutaneous. So option A regular, option B Lanti, option C NPH, option D 70 per 30 it is. So what is the correct answer here? Can you say that? Yeah, regular insulin. Because regular insulin only we can give as a IV and also subcutaneous. Other injection we can't able to do it. Okay, fine. Next question. If a client type 1 insulin dependent diabetes mellitus receives 5 units of NPH insulin every morning at 7 a.m., the nurse should closely monitor the client's signs of hypoglycemia at what time it is. Actually, what is that is? NPH insulin, they are given 5 units it is. So when they are given it is 7 o'clock, they are given it is. Okay. Option A 3 p.m., option B 12 a.m., option C 7:30 a.m., option D 10 p.m. See, actually I have explained you NPH insulin, it is going to be reach at 6 to 8 hours it is. So that is mean 7 a.m. they are given means 8, 9, 10, 11, 12, 1, 2, 3. It is going to be reach at 3 p.m. That is why option A 3 p.m. will be the correct answer. I think this is all the question related to insulin only. Okay, next move on to the 16th question. NPH is an example of which type of insulin it is? Option A short acting, option B intermediate acting, option C rapid acting, option D long acting. Can you give the example? That is, yeah, what is that it is? Always NPH insulin is a intermediate acting it is. So that is why option B will be the correct answer. 17th question. The nurse is preparing a discharge plan for 65 years old man with a new diagnosis of congestive cardiac failure. The discharge order include furosemide 40 mg by mouth twice a day. The nurse recommend food to reduce unwanted medication side effect test. So, which of the following food would be most appropriate to include in the teaching plan it is? So, option A, green and leafy vegetables. Option B, bananas and orange. Option C, chicken and fish. Option D, whole wheat grain it is. Actually, what is the question here? It is they are given with 65 years old with congestive heart failure. But what is the drug they are given? Furosemide. Furosemide is the action of laxative. So if you are giving laxative, automatically your body is going to lose of fluids and also minerals. So according to this, which is going to be lack, it is that sodium and potassium. So that is why option B, banana and orange, you have to provide for the patient. It is. So option B will be the correct answer. 18 question. The child come into the clinic with several lesions to the scalp. The round lesion have dandruff like scaling with the head. What is the most likely diagnosis for the skin condition it is? So option A, impetigo. Option B, ringworm. Option C, pediclos capitis. Option D, scabies it is. Actually, what is the conditions? Several lesion on the scalp and the round lesion have dandruff like scaling with the hair it is. So actually, if it is a dandruff it is coming, that is means it related to the, what is that it is? It is related to the ringworm, tinea capitis. So option B will be the correct answer. I think you look at the picture, you will understand that it is. 19th question. A 40-year-old woman suffered an automobile accident 1 month ago. The accident resulted in a C4 spinal cord injury, that is cervical injury. So her preventive care include independent daily performance of coughing and deep breath, and also which range of motion exercise would be most beneficial for the patient it is. Option A, active. Option B, passive. Option C, combined. Option D, recessive. Actually, what is that it is? Before 1 month ago. So the patient got spinal cord injury it is. That means what is the exercise you have to prepare for, active or passive? No, it should be passive exercise. So someone should be assisted for the client it is for the exercise. That is why option B will be the correct answer. Next, move on to the 20th question. A 9-year-old girl has nursing diagnosis of alternated body image related to changes in appearance secondary to varicella infection. The child body is covered with rash and many large weeping pustules. The nurse providing counseling to the mother who is concerned that the child will develop which intervention is most appropriate it is. So option A, keep the skin out of the direct sunlight. Option B, apply calamine lotion to skin every 2 hours. Option C, wash pustules with soap and keep dry it is. Option D, soak in colloidal oatmeal bath 3 times daily it is. So what you do for the child it is, that is a 9-year child it is. So what is a varicella infection it is. Now you can look at the picture how the infection was there. That means what you have to tell the patient, you have to soak in the colloidal oatmeal bath 3 times daily. So that is why option D will be the correct answer, and also it is going to be soothe the infection it is. Question number 21. A nurse is assessing a client with possible Cushing syndrome. In a client with Cushing syndrome, the nurse expects to find option A, weight gain in arms and legs. Option B, thick coarse skin. Option C, hypotension. Option D, deposit of adipose tissue in the trunk and dorsocervical area it is. How it was looking for the patient it is, if the patient is having ACTH or Cushing syndrome. So what is the correct answer? Deposition of adipose tissue in the trunk and also dorsocervical area it is. Central obesity in a buffalo hump will be there. So that is the correct answer for this question it is. Okay, fine. We can move on to the 22 question. Which vitamin deficiency is most likely to be a long-term consequence of a full thickness burn injury it is? Option A, vitamin A. Option B, vitamin B. Option C, vitamin C. Option D, vitamin D. Usually which vitamin is going to be lack for full thickness of burn injury, that is vitamin D. Everyone knows because of the skin is broken down means vitamin D is not going to be absorbed from the sunlight it is. So always it is lacking of the vitamin D it is. That is why option D will be the correct answer. Next question. Sildenafil, that is Viagra, is prescribed to treat with erectile dysfunction. A nurse review the client medical record and would question the prescription if which of the following is noted in the client history. It is option A, neuralgia, option B, insomnia, option C, use of nitroglycerin, option D, use of multivitamin. So before giving to the Viagra, that is what you have to ask the client it is. What is that? Option C, use of nitroglycerin. So that will be the correct answer for this question it is. Okay, next move on to the another. The physician order 1 liter of normal saline infusion for 4 hours. How much NS should be delivered to the patient in 1 hour? So option A 150 ml, option B 250 ml, option C 350 ml, option D 520 ml. Actually, what is the question? 1 liter, that is on 4 hours. If it is 1 hour, so you divide by 1000 divided by 4, that is 250 ml. So that is a correct answer, means option B 250 ml is a correct answer. Okay, next question. Best diagnostic test for suspected leukemia is option A, bone marrow aspiration, option B, blood chemistry, option C, CBC, option D, PT and PTT, that is prothrombin tinnitus, that is the thing. Okay, so what is that? It a question, suspected leukemia, that means we are going to be confirm the leukemia. Okay, so what is the best test it is? Yeah, that is bone marrow aspiration, because we are going to find out all the blood cells counted from the aspirations. So the best answer is, what is that? It is option A, bone marrow aspiration. Next question. The primary nursing goal when caring for a child with leukemia is option A, take vital signs, option B, provide good nutrition, option C, give analgesic, option D, prevent infection. It is what is the best action it is? That is, what is that? What you have to do for the patient is having leukemia, automatically what is going to be decrease immunity. So that is why you have to prevent the infection is very essential. So option D will be the correct answer. Next, move on to the 27 question. Okay, the oxygen flow rate of the nasal cannula is considered to be option A 1 to 6 liter per minute, option B 3 to 8 liter per minute, option C 5 to 10 liter per minute, option D 10 to 15 liter per minute. So what is the correct answer here? Through the nasal cannula. So that is otherwise called it as nasal pharynx also they will say. So that means what is the correct answer here? 1 to 6 liter. So option A will be the correct answer. Other flow meter I have given, you can watch the pictures also. Next question. If the client develops a thrombus in one of the leg veins, which client response would the nurse expect when eliciting Homan sinusitis? Option A, sharp immediate cough pain. Option B, sudden numbness in the foot. Option C, inability to bend the knee when asked. Option D, tinkly throughout the affected leg it is. So what is the correct answer here? So whenever you are doing the Homan sign, what will be getting there? You will be getting the sharp immediate cough pain will be there. So that is why option A will be the correct answer. You just look at the picture how you have to do the common signs also. I think you have understand the questions. Okay, fine. Next, move on to the another question. When the nurse assesses the client for Homan sign, which technique is most accurate it is? Option A, have the client push each foot against the mattress. Option B, have the client extend the legs and flex each foot toward the head. Option C, ask the client to sit up in bed and point all the toes to forward. Option D, ask the client to contract the thigh muscle. It is. So what is the correct answer here? So what you have to do, how you have to do the procedure? Okay, you can look the pictures. Yeah, what you have to do? Client extend the legs and flex the each foot towards the head it is. So that will be the correct posture for doing the Homan sign it is. So when you are doing this Homan sign, you will get the pain and the calf muscles below that. So that will be the correct answer to identify the deep vein thrombosis. 30 questions. The phase that include action of the nursing care plan is called option A implementation, option B diagnosis, option C assessment, option D evaluation. Usually when we are going to do the nursing care plan action, action means we are going to do some planning for them. After planning we are going to implement. So that means what is the correct answer here? Yeah, option A implementation is the correct answer. Okay, move on to the next question. After vein ligation and striping operation, the patient should option A wear elastic stockings, option B do exercise, option C rest the leg, option D avoid walking. It is. So what you have to do for the patient? It is mainly for which one? It is after vein ligation. It is. So what the correct answer is? First you have to be rest the leg. Option C will be the correct answer. Next you have to wear the elastic stocking. It is. So option C and A will be the correct answer. Move on to the next question. Rabies disease is considered option A viral disease, option B bacterial disease, option C protozoal disease, option D fungal disease. What is the correct answer here? Yeah, rabies disease is going to be caused by rabies virus. It is happened because of the dog bite only. So that is why option A viral disease will be the correct answer for this question. It is. Okay, move on to the next question. A client receiving IV infusion, the skin around the IV insertion site is red, warm to touch and painful. So the nurse should first option A discontinue the IV, option B slow the IV rate for 30 minutes then reassess the site, option C place a cold compression on the area, option D place a warm compression on area. It is. So what is the correct answer here? Can you guess that? Yeah, what you have to do? So whenever the IV site is reddened and also it is giving it painful and when you are touching it was very warm, that means what is that? It is blood clot was happened there. So that is why you have to be stop the IV. So that means what is the correct answer here? Yeah, option A discontinue the IV will be the correct answer. Move on to the another question. A client who have cast applied to an extremity must be monitored for complications. The most significant complications for which the nurse should assess the client extremity is option A warmth, option B numbness, option C skin disformation, option D generalized discomfort. It is. What is the question here? It is. Yeah, complication of cost applications. So when you are going to be find what will happen that it is, yeah, it is going to be decreased blood circulation means automatically decrease it is. So that is why you have to check the color of the skin. Bluish color will be there and numbness, tingling sensation because of the decreased blood circulation to the particular area it is. So that is why option B numbness is the correct answer. Next question. A nurse is assessing the leg of a client whose 36 weeks pregnant. Which finding should the nurse accept? Option A absent pedal pulse, option B bilateral dependent edema, option C sluggish capillary refill, option D unilateral cough enlargement. It is. Which one is absent for that? It is except they are asking this. What is the answer? Bilateral dependent edema. That will be the correct answer for 36 weeks of pregnancy. It is because it was happened for the normally it was there for the mother for during 36 weeks pregnancy. So that is why option B will be the correct answer. Next question. Which of the following is the best nursing action to assess pulse in a toddler patient? It is. The question is toddler. Option A assess the brachial artery with the middle finger and index. Option B assess the tarsalis pedis artery with your palm. Option C assess the carotid artery with the forefinger. Option D assess the radial artery using the three finger. It is. So what is the best and correct answer? It is. What is that? The patient is having toddler. So you have to assess only the brachial artery with the help of the middle finger and index finger. We have to assess brachial artery in between the shoulder and elbow. It is. That means option A will be the correct answer. You can look at the picture. You will confirm the brachial press, and also you will clear the answer. Next question. One nursing intervention for patient with productive cough is to facilitate removal of secretion. This can be done by option A, encourage the patient to perform slow and shallow breathing. Option B, encourage the patient to increase fluid intake. Option C, encourage the patient to hyperventilate. Option D, encourage the patient to decrease fluid intake. What could be the correct answer here? Actually, the patient is having productive cough it is. So what you have to tell the patient it is? You have to tell the patient what is that it is. How to remove the secretion. Encourage the patient to increase fluid intake. It will be increase the secretions also. It will be come out it is. Next question. A 73-year-old patient look at you when you speak to her. When you ask her the date, she says blue. You note left-sided weakness when she grip your what is her class score. So what is the answer here? Option A 11 by 15. Option B 12 by 15. Option C 13 by 15. Option D 14 by 15 it is. So what is the correct answer here? When you ask her to date, she says blue. So that means what is the correct answer here? Yeah, when you are going to say assessment, that is 13 by 15. So option C will be the correct answer. Next question. A patient during examination open his eyes in response to pain, make no verbal response but withdraw from pain. So what is the Glasgow coma scale for this patient? Option A 3, option B 5, option C 7, option D 11 it is. So what is the correct answer here? A patient during open his eyes in response to pain, but a verbal response but withdraw from the pain it is. Can you look at the pictures? Okay, from the eyes are going to be opening, that with the help of the sound. So that is why eye opening is 3, and with the help of the verbal response, sound is going to be give. So the response is 2 it is. So totally 3 plus 2 5. So the Glasgow cumulative score is 5 by 12 letters. So that is why option B will be the correct answer. Next question. A newborn Apgar score at 1 and 5 minutes is 5 and 10. On half an hour later, the baby become bluish in color with heart rate 140 per minute. So the first action would be option A, estimate the score again. Option B, shower the baby with warm water. Option C, give oxygen immediately. Option D, ignore the finding because it is normal. Actually, the child is having, what is that? It is bluish in color. That means cyanosis. So that is why you have to administer oxygen, that is immediately. So option C will be the correct answer. Next question. The primary critical observation for Apgar scoring is the option A, heart rate. Option B, respiratory rate. Option C, presence of meconium. Option D, evaluation of the Moro reflex it is. So what is the correct answer here? Yeah, what you have to check in the Apgar first it is, what is that it is? Heart rate, respiratory rate, presence of meconium, evaluation. What do you have to do for that? That is heart rate it is. So that is why option A will be the correct answer. Next, move on to the another. When performing newborn assessment, the nurse should measure the vital signs in the following sequence. Option A, pulse, respiration, temperature. Option B, temperature, pulse, respiration. Option C, respiration, temperature, pulse. Option D, respiration, pulse, temperature it is. So what is the correct answer here? How you have to check that? It is for the newborn it is. So first you have to check the respiration, then pulse, then temperature it is. That is the correct answer. Okay, move on to the another question. Within the 3 minutes after birth, the normal heart rate of the infant may range between option A 100 to 180, option B 130 to 170, option C 120 to 160, option D 100 and 130 it is. So what is the correct answer here for the infant? Within the 3 minutes after birth. That means within the 3 minutes after birth it is. So that means it's a newborn only. So what is the correct answer here? Yeah. Option C 120 to 160 beats per minute will be the correct answer. Next question. The expected respiratory rate of a neonate within 3 minutes of birth may be as high as Option A 40, option B 60, option C 80, option D 100 it is. What is the question? It is 3 minutes of birth may be as high as. So the correct answer is, what is that? It is option B 60 will be the correct answer. Next, move on to the another question. When performing nursing care of a neonate after a birth, which intervention has the higher nursing priority? It is option A obtain a dextrostrix, option B give the initial birth, option C give the vitamin K injection, option D cover the neonatal head with a catheter. So that is means what is the priority they are given. See, everything is essential one day, but which one is the first priority you have to do after the birth of the baby? It is, what is the correct answer here? Yeah, you have to cover the neonate head with the catheter. So option D will be the correct answer. Next, we are going to give the injections, then only we are going to bath and dextrose. So everything will be later only. Okay, fine. Next, move on to the another question. Which of the following instructions are appropriate for the nurse to give the patient about the time of taking omeprazole tablet? It is option A take the tablet during the meal, option B take the tablet 2 hours after the meal, option C take the tablet 30 to 45 minutes before the meal, option D take the tablet before bedtime. It is, what is the best answer here? It is, see, actually when the omeprazole is going to be controlled, the antacid it is, so you have to take before meal. So that is why what is the correct answer here? Option C take the tablet 30 to 45 minutes before the meal. So option C will be the correct answer. Next, move on to the another question. Road traffic accident, patient arrived to ER. On examination, the patient has increased heart rate, low blood pressure and decreased level of consciousness. You must think that the patient is developing option A coma, option B UTI, option C shock, option D respiratory arrest. Actually, the patient came with emergency department, but with the complaints of, what is that? Low heart rate, low BP and a high heart rate it is, and also decreased LOC. That means what is that? The patient is going for shock, it is hypovolemic shock it is. So that is why option C will be the correct answer. Okay, move on to the next question. Which of the following diseases has no vaccinations? Option A smallpox, option B measles, option C poliomyelitis, option D chickenpox it is. So which of the following? No vaccine, still there is no vaccine for what is the conditions it is? That is chickenpox it is. So that is why option D chickenpox will be the correct answer, because smallpox and measles everywhere we are having the vaccines available. Okay, next question. The type of burn in which all the dermis and epidermis is destroyed and there is involvement of underlying structure is called. So option A superficial or first degree burns, option B partial thickness or second degree burns, option C full thickness or third degree burn, option D fourth degree burn it is. So what is the correct answer here? If you want more questions, you can follow on the WhatsApp and Telegram channel Nurse Genius App. You having more questions it is. Okay, what is the correct answer here? The person is having burns it is. So what is the best answer here? Full thickness or third degree burns. That is option C will be the correct answer. We have completed 50 questions. If you like this video, kindly subscribe to the channel and also follow on the WhatsApp and Telegram channel. And also Nurse Genius App, you have all the questions are available. Thank you for watching. All the best for your exam. Thank you.